Le riunioni di Sitges hanno avuto un modello, a mio avviso, straordinario. È stato un mix di advocacy a livello globale.
Lo que hicimos fue poner por primera vez la hepatitis y la coinfección encima de la mesa. Porque era una situación de la que no se hablaba. Había unos tratamientos que no funcionaban. Había una cantidad de muertes que era inaceptable en aquella época, que tantas personas que habían sobrevivido al VIH al final murieran por complicaciones hepáticas.
La prima cosa è stata veramente allertare anche attraverso questi meeting la community che questo era un problema che dovevamo affrontare.
This was a community-led initiative, and it really was the push coming from several people. I do remember that meeting from Louis where he said, we need to take this up the stage, and we need to create a budget for it. And the key thing there is that if we wanted to address a problem, all of the people that we needed to talk to were in that room. All the people were there together.
The objective was originally to include people living with hepatitis C co-infection in clinical trials, which were not accessible. Once that step was reached, the clear objective was access.
Abbiamo capito che avevamo bisogno di uno spazio un po' internazionale, perché gli stakeholder sarebbero state le agenzie regolatorie, le industrie farmaceutiche, e quindi la grande mamma EATG, diciamo così, ci ha supportato per dare vita a Sitges, che fu proprio un vero progetto di advocacy sui trattamenti dell'epatite C.
With our experience, with the long collaboration experience we had with the European AIDS Treatment Group, we were interested in understanding how this could work by bringing in other stakeholders, like, of course, the healthcare providers, but also the regulators.
I think one should not underestimate that in contrast to many other chronic diseases, the role of community is so different in HIV. And I think you can only push things if people have a voice.
Together, we decided we should have a sort of think tank meeting to bring a lot of different stakeholders together to sort of figure out what we could do to address the problem in a very constructive, collaborative manner. And it was just an amazing meeting, absolutely amazing.
Un éxito, no, muchos éxitos, y sobre todo el fundamental, las millones de vidas que se han salvado gracias a los cambios que se produjeron en los encuentros de Sitges. Y la lástima, la rabia de que muchas personas no se pudieran beneficiar de lo que luego ha venido. Pero sí, felicidad por lo conseguido. Se puede replicar.
To me, the most important outcome of the Sitges meeting was that I have still around some friends that I knew, including myself, that would be dead if we would not work and accelerate the process of clinical trial design, inclusion, and access. Many didn't believe that we could have a treatment without interferon. That was also one of the biggest requests to FDA, was to allow these pilot projects, pilot clinical trials, proof of concept. And we had 10 people, 10 cured in 3 months treatment.
I think from our perspective, there were two major aspects where these meetings were very valuable. The first was the general sort of to spread the word, in a sense, of the sense of urgency with the promise of the products that were being developed. On the other hand, there was very little experience in patients with decompensated liver disease. And I think that the conversations that we had on this situation was very helpful for regulatory decision making.
It's time to start listening to communities more about what they want and what they need, and think of a smarter more human way to develop drugs that's just as efficient, that gets the results that we need, that gets the drugs out to the people, but that is much more humanistic, not exceedingly profit-driven.
Gracias al proyecto Belong por echar esa mirada atrás, por recuperar la memoria y de esa recuperación de memoria aprender y mirar hacia el futuro. O sea, felicidades porque creo que estáis haciendo un buen trabajo y este documental es una prueba de ello.
I said, Tracy, we have to do something about it. And I went back to the EATG and to the BOD and to everyone, and I said, we have to do something about it. And people will say, well, maybe it's too early, it's too preliminary, well, whatever. People are dying. We have to start now.